Okay, whatever you're ready.
All right, before we begin our presentation, we wanted to ask you guys a question to kind of get you thinking about our topic a little bit. So we want you to think back to when you were age 17. More specifically, your ability to make your own decisions at that age. Now, we're not talking about decisions about boys or girls or what you wore to high school, but more specifically, decisions about your own health. So we want to hear back from you guys. On a scale of 1 to 10, do you believe you were mature enough to make decisions when it came down to your health? If you were in a life or death situation with a doctor, do you believe that you were mature enough to make those decisions? 1 to 10?
7.
7. Okay.
8.
An 8. 17 years old?
8.
8. Okay. So kind of in that higher range of things. So kind of think about that mindset, you personally as a 17-year-old, so you can kind of get in the mind of the patient involved in the case we're going to be discussing today.
I care about the quality of my life, not just the quantity, and that came from 17-year-old Cassandra Callender speaking out about her life. My name is Cassie White.
And my name is Sarah Turley.
And today we will be examining the case of Cassandra versus the state of Connecticut. Please feel free to ask us any questions throughout this presentation, and we also have some questions in here incorporated to ask you guys throughout as well.
We're going to start with some background about our case. Cassandra Callender, or Cassandra C as the media referred to her, was diagnosed with Hodgkin's lymphoma at age 17. When it came to choosing her treatment, Cassandra decided to refuse chemotherapy. She researched more natural options and she decided to go with that. She also didn't like the idea of the long-term symptoms that would happen from chemotherapy, like organ failure. This scared her, especially as a 17-year-old girl. Also, she didn't want to deal with the side effects of chemo while getting the treatment, like the nausea, the fatigue, and the other bad things that come along with the treatment. So after discussing with doctors and researching, she decided that natural alternatives would be a better option. But the problem was that Cassandra was legally a minor in this situation, so it was up to her mom to decide for her. So her mom decided with her daughter and said that they wanted to refuse chemotherapy as their treatment.
So we have this quote here that says, "Courts have the authority to overrule parents when their medical decisions threaten the life or health of their offspring." So separate lawyers sought to have Cassandra come into this court case as a mature minor. However, fast forward to January 8th, 2015, she was ruled a non-mature minor and her mom was ruled an unfit medical guardian in terms of this life-threatening situation. So the court took custody of Cassandra and ruled that chemotherapy would be forced.
So after the states took custody of Cassandra, she was admitted to a hospital where she was given mandatory chemotherapy treatments. After her first treatment, the doctors actually sedated her and put a port in her without her consent or her knowledge. They told her that this would happen every single time until she decided to comply with their treatments because, like the court ordered, this was a forced treatment. While at the hospital, her cell phone was also taken away because they decided that her mother was a bad influence on her and that she would also be a problem when it came to complying to the treatments. And her mom could only visit her during visiting hours with a social worker present. So alone in these four walls at night, she wasn't even allowed to talk to her mother on the phone. She was completely alone. Cassandra did an interview with the program, The Truth About Cancer, following her whole 5-month ordeal. And after we watched it together, we kind of picked out some quotes that stood out to us to get an idea of kind of the things that she went through. So the first quote says, "The doctors told her chemo was the only option."
In this interview, she also stated that they had about 12 cop cars surrounding her house, as well as some social workers that came in when they took custody of her.
And during this whole ordeal where they surrounded her house and made her go to the hospital and get these mandatory treatments, she says, "My mom wasn't even home. I was hiding in my closet upstairs."
She also states that at the time, I didn't know that I didn't have a choice.
Then after her first kind of set of chemo treatments, she says, "I did about 2 days of chemo and hated it. I had to run away." After that first week of treatment, Cassandra actually ran away from the hospital she was mandatorily supposed to be at. She was missing for about a week, and law enforcement and news actually threatened her, saying that they would arrest her mother with coercion with that disappearance of her. And so then that kind of scared her to come back to the hospital after a week of her being missing.
So we have this quote here from Cassandra's mom, Jackie Fortin, and it says, "She should be home with me, her family, her friends, going through a horrible thing with all this, and she's not, she's been taken away." So this is Cassandra's mom basically just saying that she should be in the comfort of her own home, surrounded by the people that she knows and loves, not just the 4 blank white walls that she saw for 5 months and some strangers.
Cassandra wrote about her treatment experiences, and they were featured in the Doctor's Tablet blog. She writes, "I was strapped to a bed by my wrists and ankles and sedated. Being forced into surgery and chemo has traumatized me." So this is just her kind of reaching out and saying, like, she's been traumatized through all of these forced treatments. She's getting a treatment that she did not pick herself, and she's alone in the whole process of it.
Another quote here from Cassandra C. says, "At that point, I didn't feel like a human anymore. I feel like I've been violated. They locked me away, but I'm still here." So this is her basically just saying she was locked up for 5 months. No contact really with anyone, just these strangers coming in and out, doing her treatment for her. And she did not leave the hospital at all during these 5 months. And for those of you who don't know, chemo is about 6 to 9, so she was just locked up for a long time.
So when looking at this case ethically, there's really a power struggle between two main concepts. The concept of autonomy, which is kind of Cassandra's side, and her having the right to make her own decisions as a patient, and beneficence and non-maleficence, which was more of the doctor's side in this case, that they were doing no harm and they're supposed to help patients. That's their purpose as physicians. So the whole problem here is, when does one weigh out the other? When does a patient's right to decide weigh out a doctor's purpose of doing no harm?
So first we're going to start with the side of autonomy, and just to refresh, to define autonomy, it can be one's ability to make his or her own decision. So in this case, Cassandra was showing autonomy in this ethical examination by deciding initially that she did not want this chemotherapy.
So one important question we want you guys to think about is, does a 17-year-old patient who is not a legal adult still have the right of autonomy in a medical situation? So when we kind of looked at it, we see a shift of autonomy here. So since Cassandra wasn't a legal minor, her right of autonomy was shifted over to her mother. So her mother then had that right. But as we saw with the court case, after she was deemed an unfit medical guardian, that right was stripped away from her as well and given to the courts. So then that right of autonomy was stripped away from both the patient and her mother, and the courts got to decide what happened with the treatment. So just kind of think about that and see if you think that a 17-year-old patient still has that right of autonomy.
Right, moving on to non-maleficence and beneficence, just to refresh, non-maleficence is doing no harm, and beneficence is giving your patient the most beneficial outcome, or giving them the most beneficial route to have the most beneficial outcome.
So I feel like to better understand this concept, it's important to understand Cassandra's condition. So according to the American Cancer Society, Hodgkin's lymphoma is a cancer that affects part of the immune system called the lymphatic system. The survival rate of this disease is about 80% with chemotherapy. 80% is a very high cure rate for something of this size of a disease. And yearly there are about 1,050 deaths as a result of the disease. So when doctors looked at this case, they see that this 17-year-old girl has about an 80% of survival with this treatment. So it's hard for them to make that decision when she comes back and says she doesn't want the treatment.
All right, so going back to the side of non-maleficence and beneficence, we have that it's easy to conclude that the treatment would be doing more good than harm, considering chemo could potentially save Cassandra's life and give her the benefit of life. However, she did have to undergo the discomfort of this chemotherapy and also go through more unethical activity that came with forcing that. So from the doctor's standpoint, going through with Cassandra's natural alternative treatment that she wanted initially rather than chemo, they believed that it would not allow them to give her the appropriate quality of care that was possible. And in doing so, this inflicted more harm than not. So if this procedure was over with quickly, the chemo, it would be easy to say that it would have been forced.
It would have been a better option.
Yeah, it would have been less more good than harm if it was done quicker. However, it was only over the course of 5 months, so she had to endure that pain over and over and over again.
So a question we want you guys to think about is kind of more of the physician standpoint. Is risking the possibility of a patient's death worth following their rights of autonomy? So if the doctors were to decide, okay, we're going to go with your national alternatives, that's your choice, that's your right of autonomy, they would be risking the death of the 17-year-old girl. When in the case that the court decided, they sided with the doctors and said, you know what, you have research, you have backing about this 80% proven cure treatment plan, and so we're going to force that above the patient, even overlooking her rights of autonomy.
All right, so we're going to start with my views of the case. I believe that the court should have basically just allowed Cassandra to go through with her alternative treatment. So I believe that with the knowledge that she was going to go through with this, I don't believe that the chemo should have been necessarily forced. By forcing chemo, other forceful things occurred, including the sedation that Sarah had mentioned earlier. And for those of you who don't know, you cannot eat while on sedatives, so she would go days and days without eating because she would not comply or cooperate. I don't believe that the chemo was necessary, and I would have opted for the natural alternative care as well to reduce the cancer-associated pain, the anxiety and stress, the nausea, the vomiting, the fatigue. Alternative medications, however, do have side effects. So anything that's labeled natural or herbal can cause liver toxicity and kidney damage. And then I also have a quote. According to the Jesse and Julie Rash Foundation, many individuals with cancer report significant symptom relief and in some cases the remission or complete disappearance of their disease. 22% and up to 69% of cancer patients do opt for natural and alternative care. And ultimately, I believe the extreme measures were taken unnecessarily, and since Cassandra was going to opt for natural alternative care, that her wish of autonomy should have been granted.
So after I looked at the case, I kind of went a different route. I do believe that the way the courts decided this case was wrong. A 17-year-old girl having to go through chemo, first of all, and then being alone from her family, it should have been decided a different way. But I do side with the side of the doctors because I believe that it's hard, especially a 17-year-old girl going through something as terrible as Hodgkin's lymphoma. It's harder to see the light at the end of the tunnel. But Cassandra's Hodgkin's lymphoma was stage 2, and especially with chemotherapy, that stage 2 Hodgkin's lymphoma could have been easily cured, even a higher rate of that 80% cure rate. So I feel like when you're talking about these natural treatments, the chemo side effects are very temporary, but life is forever. And I feel like eventually with these natural treatments, she would have been feeling the side effects of her cancer anyway. I do believe that the courts went about it the completely wrong way. She should have had the right to her family. She should have had that support system around her. But I do believe the doctors were right in going over Cassandra and her mother's head to try to get this girl the treatment that she needed. And it was honestly a hard situation, and it's a hard decision because when you do have that sensitive situation with overruling a mother. But honestly, in the end, I believe that overruling and maybe putting her through that 5-6 months of pain is far less of a pain than a mother losing a daughter or a daughter losing her life. So I really do side with the doctors that they were right in going over the head of the mother, but I really don't feel like the courts ruled on it the correct way that they should have. So we want to leave you guys with some final questions just to kind of expand on this topic and get you thinking more. So our first question would be, what would you do if this was your child? What would you do if your child was diagnosed with stage 2 Hodgkin's lymphoma and the autonomy was passed to you and you had to decide what their treatment would be? Would you have stuck by your child and said, no, I want natural alternatives? Or would you have gone with the doctors and said, listen, this is an 80% cure rate, you need to go through with this treatment? Secondly, this is more of a physician side. Our traumatizing compliance methods like sedation and strapping her down to do these procedures, we're saving someone's life. So kind of think of that as a physician. If you were in that position to decide, would you make her go through those compliance methods, or would you say, no, this is enough, it's not worth the traumatizing pain now just to possibly save her life in the future? And then the last thing we have is, how would you have ruled on this case as a judge? How would you have given that family rights back to the family? Would you have made her go through kind of alone so she didn't have her mother saying like, no, we need to fight this, we need to keep fighting this? How would you have ruled that to kind of make this a better ethical situation? So those are just some kind of things to think about and elaborate on. These are our sources. Does anyone have any questions?